about the impact that this war is having where I am tonight here in Israel. In Tel Aviv, it is supposed to be the first day of the working week. This city would normally be incredibly busy, but schools are closed, many workplaces are closed as well. I was talking to somebody, one of the very few people out on the streets of this normally bustling city earlier today, and they told me the only thing they could compare it to was Yom Kippur, the holiest day in the Jewish calendar, where people stay at home, they don't go out. The beaches are empty, the shelters are full, and there are precautions that are always put in place for moments like this. And we can talk to Professor Ran Balicer, who's Deputy Director General at Clalit Health Services. Professor, thank you for joining us. Tell us more about the work you've been doing to move a particularly vital service, hospitals, underground so they can continue to operate safely at times like this.
Good evening, Anna. Yeah, these are challenging times for us here in Israel. You know, missile attacks took the lives of over 10 civilians in the last 24 hours and many dozens more injured. So in this setting, we as the largest healthcare system in Israel, we have a huge responsibility. We're basically the medical shield for 5 million Israelis, providing them with all types of care, from primary care to hospital intensive care. And now we have a daily task to ensure that even under fire, more than half of the Israeli population has a doctor by their side in needs that's related and unrelated to the conflict. So that is not easy when sirens are repeatedly sounding. So, outside missiles are flying, but in our operating room, there's no conflict, there's only care. And you see Jews and Christians and Muslims and Druze all working together, one family to save lives. So, this is kind of our modus operandi of the Israeli healthcare system, and it makes us very proud and hopeful. But all of this is happening in a situation where there's a continuous missile attacks, and just a few months ago, we have experienced one of these missiles hitting one of our key hospitals, Soroka Medical Center in the south, and it was just evacuated the night before. So as lessons learned from the recent conflicts, we have now pre-prepared shelters for our inpatients. So in the case, for instance, of our main hospital in the center, Rabin Medical Center, we have taken the underground parking lot, 4 levels of underground parking lot, and have made them into underground wards where you have all of the everything that you need, from oxygen to electricity to respirators. And we have in the last 24 hours moved all of our complex patients, those that need respiration, those who are in ICU, those who have all of the complex machinery. They've all been moved down underground, where we can treat them safely when sirens are going off and when missiles are falling all around.
It is a huge undertaking. I mean, you said there that you've moved all of the patients, but that presumably involves each one being taken individually. It is a huge operation to actually move all of those sometimes very seriously ill people, physically move them, as you say, down into the underground basement of the hospitals.
And I will add on that some of the patients that are not as complex, that can be basically taken care of in the community setting as an integrated care organization that has all types of care, primary and hospital. We are, on a daily basis, have a large program of hospital at home. So we have patients that basically get all of their care, including respirated patients and very complex patients, take care at their home, and we enhance this in times of emergency like this. So some of the patients that were in the hospital setting are now being cared at home. Their oxygen gets to them, the allied health professionals get to them, the machinery gets to them, everything they need in order to provide the best standard of care at their home. And as an envelope to all of this, we also have all of our digital and online services and all our innovative services. So we have now 24 hours, 24/7 for free, primary care professionals that can provide you with care around the clock, pediatricians, mental health specialists, and all of this happens with different types of AI that's already included in our systems. We have our bots, and we have our proactive systems that try to find patients before they deteriorate or before they have a problem, even in these troubling times, and get to them proactively and provide them care so they do not deteriorate.
Professor, we've touched on it already, but could you just describe in a little more detail? Because I think unless somebody has been here and actually experienced it, what it is like to have those missile alerts, those sirens sounding sometimes a couple of times within an hour on a very regular basis, particularly when you're trying to treat patients, because each time it involves going to the shelter, waiting there for could be 10 minutes, it could be 30 minutes, it could be longer. Just describe what that is like, both as somebody who lives here, but also for the medical professionals to deal with.
So, let's take, for instance, the community setting outside of the hospital. We have 1,500 clinics all around the country from north to south where we provide daily primary care. Now, we have, in the last few years, fortified 1,000 of them. So by now, we have those places with shelters in place so they can continue providing care. So this morning, we had all of these 1,000 clinics open and running as if nothing's happening, despite the fact that missiles were flying around and sirens were going off. And the staff that had to go to these clinics actually drove them with a lot of self-risk, because this is very unadvised to roam around the streets right now when a siren could go off any minute and you have only a few minutes to find a decent shelter. So these healthcare professionals do what we expect of them, which is, even in such complex scenario, come in the morning, go to their workplace and be there in order to provide care for those that need. So we had, zero absentees. Everybody came to their shifts. Everybody came to care for their patients, and we could basically provide all of our care. And, the daily reality is that you begin driving to your workplace. That could be, half an hour drive. And you have to stop twice in the middle of the road and lie down on the ditch beside the road because you don't have a real shelter when you're driving in a highway, and just wait for the missiles to either hit or not hit. And then once the alert goes off, you go back to your car.
It has a huge impact, doesn't it? Professor Balicer, thank you very much for joining us. Well, Benjamin Netanyahu